Executive Director of the Maryland Dental Action Coalition, which is the state non-governmental organization devoted to oral health policy and advocacy in order to improve oral health for all Marylanders and obviously promote equitable access to oral health care. We are a diverse network, statewide network of dental and non-dental professionals and organizations who collaborate in 3 primarily focused areas, and that's education and literacy, as well as oral health advocacy and legislation, as well as interprofessional collaboration. And we are obviously working for, as I said, equitable access for all Marylanders, and our efforts over the past several years has focused on Medicaid adult dental benefits. So I applaud the University of Maryland and of course the providers and everybody here who are contributing and making these lives better for these adults. And we are hoping, frankly, with everybody else here, that this will be the last one. We're hopeful. There's been significant strides, which I can go into later. There is an adult dental pilot program. I am very happy to report that is providing preventive, restorative, and other services to a pilot population of dual eligible adults, Medicare and Medicaid. And so we look at this as a very important first step. However, we all recognize that there is an adult oral health crisis in Maryland, and I am working with everybody, frankly, on this panel, as well as in the room. We are partners in this. So again, I applaud everybody here for your efforts, and look forward to answering questions.
My name is Dr. Charles Doring. I'm a general dentist in Montgomery County, and I'm here representing the Maryland State Dental Association. I happen to be the trustee of the state for about 700 dentists who are ADA members, American Dental Association members in Montgomery and Prince George's County. Many of those are volunteering for this event. This is being the 3rd one here at the Xfinity Center, really a family affair. My wife Ellen is in the back going to be doing registration. Elizabeth, the dental assistant, is going to be helping and translating the dental assistant. We're carpooling the whole office over here tomorrow to be here at 6 a.m. So we're really excited. For me too, I'm also an alumnus of this institution, and for Maryland to give back like this is really something. I'm also an alumnus from the University of Maryland School of Dentistry in Baltimore, and we have many students coming to participate in helping along with this event. Along with the Maryland State Dental Association, we also have a charitable arm, the MSDA Foundation is proud to help sponsor the Mid-Maryland Mission of Mercy and other 5 non-projects across the state of Maryland. Our organization works to ensure that every Marylander has access to the best dental care available. We do this through events such as Mission of Mercy, services to the handicapped and elderly, helping doctors and emergency departments understand the unique needs of oral health of patients, advocating public policy to help break down barriers to care. That includes, as Mary referred to, the adult dental Medicaid pilot program, which I am participating in, and is taking off very well. So we're excited about that. And that just recently started actually here. Yeah. Another thing to mention with this particular Mission of Mercy, patients come in and there might be 10 cavities, and we try to be fair to everyone and take care of the most urgent needs, and maybe do 2 or 3 fillings, but that leaves 7 or 8 undone. So we have a product called silver diamond fluoride that can be applied to arrest tooth decay. It's a relatively new product that's going through FDA study. We have a study with the University of Maryland School of Dentistry, and we'll have this product available for our patients. We had it at the last Mission of Mercy when the product just became available, and now we're actually going to work with the dental school and offer that to our patients. It does stop and arrest tooth decay, which is a great thing. The downfall is it does stain the decay plaque. So for front teeth that can be an issue for some patients. So I could be happy to fill more people in on that if they'd like. Anyhow, again, I'm honored to be here as part of the community to help our fellow Marylanders. And our dentists look forward to treating as many patients as possible over the next couple of days. So thank you very much.
Those are really good remarks. I'm sorry to have to follow this. I'm George Leventhal, and I'm Director of Community Health for Washington, D.C. and suburban Maryland for Kaiser Permanente. Kaiser Permanente is the region's leading health system. We have a unique approach that we are not only an insurance company, although we have subscribers who get their health coverage from us. We are a healthcare delivery system. And so if you are a Kaiser Permanente member, you are going to see Kaiser Permanente doctors at Kaiser Permanente medical office buildings. That combination of being a healthcare provider and a payer gives us every incentive to ensure that our members have the benefit of total health. We don't pay our bills through fee-for-service because we are also the payer, and therefore we benefit not only because you get that warm feeling that you're doing good and helping people, but we also spend less per capita when patients enjoy total health. And so my job is to advance those aspects of community health that take place outside the four walls of our medical office buildings. We know that only 20% of the total health of an individual relates to visits to the doctor. The other 80% are all environmental factors: access to employment, access to transportation, access to housing, access to basic care, and we are deeply committed to the health not only of our members but the communities that we serve. Where we're spotty, I will confess, is in providing access to dental care for those without insurance. And generally what we see is a patchwork system of providing access to dental care. It has not been a core part of Medicaid, although I appreciate hearing what the Maryland Dental Action Coalition is working towards. It's only a pilot. We don't have sufficient access to oral health and dental care for those individuals who don't have comprehensive health coverage. And so Kaiser Permanente wants to be part of the solution, and this is an excellent example of a private-public partnership, a broad-based, community-wide partnership involving our flagship public research university, involving the religious community. I know the Archdiocese is involved, involving major health systems and other payers. This is the kind of partnership that Kaiser Permanente likes to foster and that we're very happy to be a part of here at the Mission of Mercy. I know that the demand is enormous, and I know that we will see on the floor of the Xfinity Center here in the next couple of days visible physical evidence, and I do hope that members of the media will help spread this story about the enormous demand and the enormous need for access to oral care and dental health. And finally, since Dr. Goring shared his TURP affiliation, I will tell you that I was proud to have received my PhD in public policy from this great institution, the School of Public Policy, in 2017 at my advanced age. So go Terps.
Great. Say welcome home, right? Good afternoon, everyone. My name is Monica Schmoody. I'm president of Cigna Mid-Atlantic. I'm thrilled to be with you here today to open up a dialogue about this event. Cigna has been the presenting sponsor for the Mission of Mercy for the past 4 years, the 4 times it's been held, and we are proud to be here again today to help support it. As mentioned before, it becomes a family affair for Cigna as well, to show up in many ways. So also as the executive sponsor, it was my role this year to bring in the community, to bring in other business leaders, healthcare providers, to make sure that this event is shared broadly, as well as the need that all the other panelists have spoke about. So we're hopeful that we continue to push that message forward out into the community and have lots of folks come out and meet with us and have services here today. Cigna is also part of the Health Equity Expo. We have our health improvement tour here, providing free screenings to attendees. So think of that as health information, screenings overall for health conditions, as well as biometric screenings, and then talking about what those numbers mean to the individual. So again, I thank the Archdiocese, University of Maryland, Dr. Thomas, Dr. Lushman, for having us here again today, because this truly is a partnership that we've built through time. And I urge the press who are here today to share the message. Let's talk about what we're doing here today.
bring more individuals out, let's grow the event, and then serve the need that the other panelists have mentioned as well. So thank you.
Hello, everyone. I am Dr. Luciola Lapeschini. I am the Director for Dental Services at Catholic Service. It's our pleasure to be part of this grand event, the Mission of Mercy. I also joined Maryland Dental Action Coalition. I work with Alice and Mary as well. I truly believe that there is a lot of need on the population, and they need and deserve the access to dental health. And actually, I hope this is just the start. Like, we encourage our patients in the dental clinic. I hope we can offer them a dental home to all those individuals if they don't have insurance. I have seen firsthand a couple of patients that they will attend to a basement clinic that there is no proper sterilization, and then we're seeing them after the fact, even though sometimes they were charged like $100. And for these individuals, they don't have insurance. It's a lot of money. They are just working per hour, and they have to spend $100, and plus that, they are exposed to infectious disease like HIV, hepatitis B, or hepatitis C, and then they are coming like with complications like sinus communication, or it's not healing, or sometimes they pull the wrong tooth because they didn't have enough diagnostic tools to see what happened. So there is a lot of need out in the community. And also I'm proud for Catholic Charity's dental services because it differs from other community clinics. We provide a specialty care. Sometimes we have a 12-week waiting list for an endodontist, but we do provide. And other community clinics around the area, they will refer the special care like oral surgeon, endodontist, periodontist. Also, like Monica was saying, it's great that you're all here and you can speak out loud for us, and like volunteers sometimes. Last weekend I was in international volunteer best practices. So there is a lot of people that they go to Africa, to South America, Central America, because there is a lot of need. But there is also a lot of need here in-house. So charity starts at home. So really you don't need to take a ticket to go someplace. Yeah, it's fine, you can get a vacation, but also you can do it like through the whole year. You don't need take Mission of Mercy to be the start, that you came, you volunteer, but you can still work with a lot of people in need through the year. So, thank you.
So, I'm Dr. Stephen Thomas. I'm a professor in our Department of Health Policy and Management, and I direct the Maryland Center for Health Equity. And I responded to the challenge, the Fearless Idea Challenge. That's our theme here, Fearless Ideas. When the president of the university said we need to reimagine our land-grant mission. We are a land-grant institution. That land-grant charter was set in motion by Abraham Lincoln. And the president asked, we need to reimagine our commitment. I think that the Mission of Mercy and what this demonstrates is the best demonstration of our land-grant mission. Look what we have here. We have in that arena, we have represented here, organizations that in the daily rough and tumble world of business compete. And today they cooperate. We have volunteers from across a whole range of the health professional ecosystem, all here, not isolated in their nursing building, their dental building, their medical building, their public health building. They've all come out of their buildings. We had to come into an arena to create space for the interprofessional education that's going to take place here. Tomorrow, that line will begin, and I typically arrive at 5 in the morning. The line is already as long as the eye can see. You have to ask yourself a question. We are 9 miles from the White House, in the richest country in the world, where thousands of people will line up to sleep outside overnight because they have dental needs. Now, if you've ever had dental pain, you might sleep outside overnight and get it taken care of. But when they walk through the door, they walk through the door with type 2 diabetes, hypertension, and a whole range of other health conditions, some of which are totally preventable. But they don't know that until they actually come here and have a chance to have their mouth taken care of and talk to all the other health professionals that we have in this arena. So on the health festival side, in addition to the biometrics, so say you come through the biometrics and you find out, here's my cholesterol reading, here's my blood pressure. Someone's explaining what that means. Well, you simply walk to the next table and you're actually talking to a cardiologist, or you're talking to a diabetologist. You're getting your eyes checked. You're getting a flu shot. There's no place in the country where you have all that under one roof. And so I think that this Mission and Mercy model is something that we need to explore. I was on the phone earlier today with members of Congress. They want to hold a congressional hearing on healthy aging. They're asking me the question, how many people show up to this event who are age 65 and over? I told them over 40%. So this is the doorway to the rest of the body, and hopefully a model for what comprehensive wraparound care should look like. Last but not least, when you go down to the question, there's a lot of high technology here. Wraparound x-rays, iPad distribution of information, 3D printers. For some, they'll get a permanent crown today. A laboratory will build dentures, or flippers as they call them. You don't have that in any one place. We've created it here in this space. And so I think that our students, who now are going to have a chance to meet their neighbors, will leave this institution with a greater sense of empathy and a greater sense of a commitment to giving back once they leave school and start their professions. And you're right, we don't have to get on an airplane and fly down to Puerto Rico or some other third world country. We can stay right here and not even leave campus. Bring those needs, those challenges, and those opportunities right here on our campus, and give our students an opportunity to give back.
And if I can add on Dr. Thomas, it's also one part that we work at Catholic Charities is about the integrated healthcare. That is not just dental and the tooth. It's like if your blood pressure is high, or if you're diabetic, you're more prone to get some dental disease. So it's all together. So I'm glad we have all the opportunity here that you, like he said, it's just one shot.
So just one last thing, the phone calls that we've been receiving. We had a woman show up in my office yesterday using medical transport just to get a voucher so she could be first in line. So that's interesting. And then we had a voicemail from a gentleman who has handicaps. He's a veteran, and he's a candidate for a kidney transplant. He cannot get the kidney transplant until he has what's called dental clearance, meaning any infection in the mouth must be taken care of before you can have a transplant, whether it's a kidney, a hip, a knee, a heart valve. There have been people on lists for more than a year who haven't been able to get the dental clearance, even though their insurance will pay for their kidney transplant. So this is the hidden little secret, the very little secret of the integration of the mouth and the rest of the body. At the Mission of Mercy, we bring the Mission of Mercy, because these events are organized independently, locally. There's a tremendous amount of pride that people have that we could pull something like this off at their local levels. But there was no organized coordination. After 2014, wisdom of the MSDA board, all of the coordinators of the Missions of Mercy in the state of Maryland sit at one table, all as a result of it. And now we're working on a unified electronic mom dental record that's used in every moms across the state. That's because, again, cooperation over competition.
I think the biggest barrier is obviously the financial costs. I mean, adults in particular have to make a choice in terms because they don't have access to dental through Medicaid. So it's a huge barrier for them. And for issues that they encounter, what happens is they go to the emergency room because the pain is so excruciating. And the emergency room cannot treat the cause. It treats the symptom. And they treat the symptom through antibiotics, pain meds, and referral to a dentist. Well, the beginning barrier was financial cost. And it turns into a vicious cycle. And so, and the coalition did a study on this and contracted with DentaQuest. And, for example, and presented results to the Maryland General Assembly. And for example, in 2016, 42,000 adults went to hospital emergency rooms with chronic dental pain and conditions. And for a total of about $23 million in total costs, and Medicaid paid for about 53% of that. But, you know, the adult Medicaid population only accounts for about 15% of the adult population in Maryland. So that is obviously, there's a disparity in terms of receiving care and being able to establish a dental home and obtain preventive care. And what happens is they come to Mission and Mercy's. And, you know, thank goodness for the University of Maryland and other facilities that do this. We're encouraged by the pilot, and the Maryland General Assembly unanimously passed the bill, which is recognition, I believe, of I know it is, their importance of dental. And, you know, we commend the Assembly for doing that. We commend the Governor for signing the bill into law, for funding it. We believe that the pilot, which will afford 33,000 adults in Maryland dental coverage, lessons learned from that pilot will most certainly show that consistent access to preventative care produces healthy outcomes, not only in the mouth, but as the doctor said, there is such a strong link between oral health and chronic conditions, diabetes, cardiovascular. So consistent care and accessibility of care will not only produce, you know, healthy mouth, but health outcomes, healthier outcomes, and as well, it'll be a healthy impact on Medicaid as well, because the expenses will go to prevention. So again, we believe it's the financial barriers, and we're confident. We feel good that the outcomes of this pilot will hopefully result in adult Medicaid for all adults.
The Maryland State Dental Association worked with the ADA Health Policy Institute, just came out with a study looking at hospital emergency department dental visits. These are non-trauma dental visits where people come in and complain of a toothache, and they're triaged, and then they are assigned a dental home to go see to take care, rather than given a narcotic, an opioid. They're given a dental home, and they're followed up by a CDHC, that's a community dental health care coordinator, who will make sure the next morning that patient has been to the dentist. And if there's any barriers, language, transportation, cost, you know, as an application for the Alabama Medicaid pilot program has been filled out and things like that, that coordinator makes sure that that patient is taken care of on that emergency thing. And then, as Mary said, the dental home is so key. We see these people, we love them, we want to take care of them, we want to take them home. But it's so much of what we do as well, as Dr. Thomas said, medical conditions, high blood pressure thing is so preventable. Dental diseases, 90% of what I do is preventable. We counsel the patient, dietary, proper oral care, we can prevent a lot of this. So I think that's ultimately our goal, is get people down. And this is just kind of a guide, if you will. And if we could take it a step further, say with social workers that are really knowledgeable about dental, community dental health care coordinators, coordinate that care for the patients, I think it's a win-win for everybody.
When you look out over the arena and you see everything that's happening, it's public health in action. That's what public health in action actually looks like. We created the big tent to bring everybody in to serve the needs of our most vulnerable. We all remember DeMonte Driver, a young boy here in Maryland, in our county, who had a toothache, turned into an infection that went to his brain. And after 2 brain surgeries, hundreds of thousands of dollars, DeMonte Driver died. And Maryland went up in alarm. And our legislators passed laws, and for children, it's a pretty good situation for kids, but not for their adult parents, brothers or sisters. They end up coming here. And so that's the dilemma we face. Hopefully Alice will talk to you about pregnant moms in the state of Maryland. If you're a pregnant mom, access to affordable dental care is made on a fast track because we know that the disease, oral infections in the mouth can affect the unborn child. But once the baby's born, mom turns back into a pumpkin with no more easy access. So we don't need to wait for someone to pass away to create the crisis for the movement we need.
However, the majority, the two major diseases that we're dealing with in these next few days have to do with diseases, tooth decay, dental caries, periodontal disease, or gum disease. And we know how to prevent those basically. But in my very biased opinion, I think we've done a very poor job of sharing that information on how to prevent these diseases with much of the general public, particularly those who are low income, those who have low levels of health literacy. We know how to prevent these diseases, but we really have not advocated this. So to me, the takeaway message is, for example, we have data right here in the state of Maryland that the majority of low-income women do not drink tap water. 94% of the central water supplies in Maryland optimally fluoridated. That is the foundation of preventing tooth decay. Many of them don't have and can't afford toothbrushes and fluoride toothpaste, another foundational thing. Pitt and Fisher sealants, which stops tooth decay on the chewing surfaces among children. And we don't have high enough uptake of this among school-aged children. We have many ways to prevent these diseases, and I would hope that a focus that we can do is to share this message, which we will be doing at our little tiny booth down here at the Center for Health Literacy. But we do know how to prevent most of these diseases. We also know how to prevent HPV, which causes most of all cancers, which we're not addressing here, and that's called through HPV vaccines. But all these things I think we should be advocating. And I would also add one other thing, and that is that we need to work with other health providers. We need to work with physicians. And to get this, it's been sitting over here too long. We got to put this back in the body because, as somebody said, the mouth is the doorway to the body, and we have to keep it healthy.
Alice, just for the camera, say your full affiliation and the name of the center you're part of.
The name of the center is the Horowitz Center for Health Literacy. It was named after my husband, who was a dental epidemiologist who worked in preventing particularly dental caries or tooth decay. And my name is Alice Horowitz. I'm in the Department of Behavioral and Community Health in our School of Public Health and also in the Center for Health Literacy.
I, prior to being the Dean of the School of Public Health, served for 5 years as the acting, or as the Deputy U.S. Surgeon General and as the acting U.S. Surgeon General. Spent 27 years in the uniform, which Alice's husband wore as well, the uniform of the United States Public Health Service Commission Board. Now I'm honored and humbled to be the Dean of the School of Public Health with a new mission, which is educating that next generation of public health leaders. And my hope is that as we are aspirational levels, as we are shooting for it, that those public health leaders won't have to run a mission university. That those public health leaders will, in fact, have in their hands the secret. And the secret really is let's take health seriously. Right? The World Health Organization defines health as complete, not partial, not just I'm almost there. It's complete. Physical, mental, and social well-being. And in the physical part, I as a physician even, trained in the physical aspects, oftentimes neglected what goes on in the mouth. That's physical. That ties in with not just the health of the rest of the body, but that ties in with how that person perceives themselves, how that person is able to interact with others, right? It interacts with that mental well-being as well as the social well-being. So my hope is that we're on the pathway not to have these. But in essence, we have to take health seriously. And this is a plea to our partners here. This is a plea to our university here. This is a plea to our state legislators. This is a plea to our national leaders. Just 8-9 miles away is a big white building. And then there's a huge dome where decisions are made on a daily basis. My plea to them, after serving for 27 years in the federal government, is darn it, do something about the health of the people of this country. It starts now. It starts this weekend. When we close this down, late Saturday, it gets empty. But let's not stop the passivity that comes from here. Thank you, Mark.